Hello, everybody. Welcome to The Week Ahead, a podcast by SBM Intelligence. I'm your host, Bisalant, and every Saturday we look at some stories shaping our continent. I believe it's not too late to say Happy Independence Day to Nigeria and Happy New Month to everyone. In today's episode, we will discuss SBM's Health Preparedness Index for 2024, a yearly report that looks at the state of the healthcare infrastructure across Nigeria. Next, we will explore the alarming findings from the Nigeria Extractive Industries Transparency Initiative, which reveals that as of June 2024, the federal government is owing a staggering $6.071 billion in unpaid oil and gas revenues. Then we'll turn our attention to Benin, where a former sports minister and a prominent businessman has been detained amid allegations of plotting a coup. What are the prospects of further coup contagion in West Africa? Joining me for insight on these stories are Bumi Bailey, Head of Research at SBM Intelligence, and Samuel Atiko, a public policy analyst. Welcome.
Thank you for having me on the program.
All right, thank you. So moving on to our first story, which is about SBM's health report. As Nigeria marks its 64th year of independence, its healthcare infrastructure continues to face significant challenges. The healthcare system remains underdeveloped, and there are many issues such as the disparity between urban and rural places, how each state prioritizes health, the problem of brain drain, understaffing, funding. We'll try to cover as much as we can today. So to my first question, Bumi, can you walk us through what this health preparedness index report is about, and what were the indicators used to measure the health infrastructure of different states in Nigeria?
Okay, hi, thanks, Kate. So the report, like it's annual report. So it's the third edition of the report that we just did. So in a way, it tries to examine the health sector, how much each state allocates to health and the impact it would actually have in the health system. So we know that during the pandemic, what happened during the COVID-19 pandemic, a lot of states, have actually tried to increase their health allocation. But even despite the fact that they've actually increased, there are more states that have increased health allocation. They are not still, their ability to actually prepare for emergencies or maybe pandemics or future diseases, they are not still prepared. For example, let's say between the period of 2021 and 2023, about 30 states increased their health allocation, right? And that amount is actually higher compared to the one from 2020 and 2023. But despite that, all the states did not score above 30, they did not score above 30. So it means that they all ranked F. So going about the index, what the indicators that we use. So we looked at the health budgets per capita. We looked at the average household. That's about which comprised of about 5 members. And then we looked at the health development index. We looked at the life expectancy, right? And we also looked at the infant mortality rates. And we looked at the doctor to patient ratio. And then we looked at the immunization among kids. That is kids between the ages of 12 to 35 months. So out of those indicators, doctors and patients actually got about 30 points, right? Compared to, let's say, infant mortality rates that got about, let's say, 25 points. Then average household got about 5 points, while the rest got about 10 points. So those are the indicators that we use.
All right, thank you. So Samuel, based on this report, what are the socioeconomic problems affecting the healthcare sector, like poverty, inflation, declining incomes, insecurity? How have these different problems disrupted healthcare delivery in Nigeria?
Yeah, I think the report is extremely very interesting, and I will encourage everybody to try to read through this report. I mean, if you have to dedicate maybe a few hours, you need to go through this report. I think the socioeconomic challenges of Nigeria, once again, things like conflict and insecurity seems to have exacerbated some of the key challenges. We know, for instance, that there are three broad areas that had caused the challenges with healthcare, within the healthcare system in Nigeria. The first one is always the delay to make that decision, which is behavioral. People tends to prefer alternative care. If you look at the papers and you try to actually more like do a systematic review, you will see that that's actually one big area, one big chunk area. And most importantly, what is driving this, apart from the behavioral component, the second one is the socioeconomic component, things like poverty. People don't, for instance, in Okiogun, for instance, I can give a good example. To access the comprehensive healthcare system, you have to travel over the waters down to the ground to actually access a good health system. And the cost of doing that before used to be 3,000 naira. Now it's jumped up because of this increase in the price of PMS. And then so you have to pay close to 10,000 naira to make that just one trip, right? So round trip is going to cost 20,000. So how can someone living in Okiogun, a very, very, very remote area, how much is the earnings of the person? Just to access the hospital, you are coughing out 20,000 minus the cost of the healthcare. That's not going to happen. So those are the things that you see this report actually drilling down on. Aside from access, which is when you make decision to get into hospital, which had been impacted by this. The second area is also locating the nearest medical facility to you. Now, the challenge is that most of those facilities, for instance, if you are in Borno State, for instance, or you are in some of the states that have faced a lot of, because of insecurity, most of the doctors have abandoned those facilities, meaning that you have to travel miles again to assess what is going. So we can go on and on and on and on. And so the problem of Nigeria, when you look at it together, they are all intertwined, and one way or the other, they lead, of course, they impede ability of people to have access to healthcare, which is unfortunately sad. I will end by saying that regardless of all these things itself, what people need to be worried about now is the fact that government itself, just like Bumi highlighted, seems not to be prioritizing what needs to be prioritized in terms of allocating resources to begin to address some of this issue. I think that's the biggest draw line for me.
All right. Yeah, speaking of budgetary allocations, one of the things that the report shows is that there are disparities in budgetary allocations among different states. As we see in the report, a state like Ebonyi has allocated like the smallest percentage. States like Cross River and Kaduna have allocated higher percentages, of their budget to health. And also from 2020 to 2023, only a few states have increased their health budget. So, Bumi, can you tell us what this disparity, what does it tell us about Nigerian government and how they prioritize health in the country?
Well, from like you earlier said, I mean, for example, Bielsa, Ekiti, and Ebonyi, I mean, they didn't get up to, let's say, from what I'm seeing, it's not even up to 4%, right? And the other states like Cross River, Kaduna, and Bauchi, they even got as high as, let's say, maybe 22% and all. So what I can see here is that despite the fact that fine, most of the states, one of the states, for example, like Cross River, increased budgetary allocation to about 4%. That should be in 2021 to about 21.1%. That says a lot. But when you actually look at our health system, it's not actually, you can't really see the impact, right? For example, look at looking from the indicators like I earlier said, doctors got about 30 points. You understand? Fine, you are increasing your budget spend on health, but how strategic have you been in actually placing those funds? For example, to the human resources like the doctors. I mean, within a space of let's say 3-4 years, I mean, the brain drain in the health sector has actually skyrocketed, right? Apart from doctors leaving Nigeria, you also have the doctors in Nigeria going on strike, complaining about the poor services and the poor working conditions in the system and the poor pay. So it's just actually very annoying that this state are actually they've actually seen this spike in budget spend, but it's not translating to what it actually needs to actually boost health delivery. I mean, right now, right, I'm sure one of the impacts of the FX reform, right, which will lead to the high cost of sourcing effects, will lead to the high cost of drugs. I mean, we've seen multinationals like GSK exit the country, and these are people that actually, provide in a way provide the drugs that are needed. I mean, the cost of, let's say, augmentin and other antibiotics have gone up to like more than 200%, which has made people to now be sourcing much cheaper alternatives like herbs. I mean, when you look at herbs, what does that actually now do to that health system? So just increased allocation is not enough. What we actually need is that, okay, let us look at those key areas, those spaces that the money would actually be needed. I mean, because if this money is spent in those areas, we won't be having the issue of doctors going on strike or the poor infrastructure in the health system. And sorry, one more thing I wanted to highlight. So if you've noticed, the three top states that had the highest budgetary allocation in 2023, Cross River, Kaduna, and Bauchi, right? Two of those states, Kaduna and Bauchi, they were even among the least, right, in the health preparedness index. I mean, fine, these countries have increased, these states have increased, but when you look at it in terms of the level where they are worse compared to now.
All right, for me, are you done, or Simi that stopped there?
Yes, I'm done.
All right,
Sorry.
All right, thank you. All right, so my next question is for Samuel. I'm glad that you touched on the companies leaving and also the prison brain drain that we're having in Nigeria. So my final question on this is, because it's actually a big issue. I know that if we all look around, if you look at your family members or people that you know, your friends, you probably know one person that's left the healthcare sector in the past year. Even people that were not in the sciences, many of them are going out to study nursing. It's really, really sad that we're losing a lot of people in that area. Coupled with the fact that there are also companies like GSK, like Sanofi leaving. So I want to ask some of that. How do you think the government is doing enough to address this? And how exactly should they effectively address this, in which they are not trying to stop people from leaving, but at the same time, they are doing better with the infrastructural issues and maybe payment or funding issues in the country?
I think, yeah, it's difficult, to stop people from leaving. People will always want to look for things that will make their family, their immediate and extended family, better. And unfortunately, the economic situation in Nigeria seems to be scourging people off. But I think it's important to say this, that there are building blocks on how you, as a country, plan for your health system. The first thing we need to think about is, what is the layer? For instance, the first layer of health system, I mean, if you're looking at the health system in Nigeria, how you build up is that within the referral system, you go to the primary healthcare center. Now, if you go to Ogun State, even before this brain drain, the challenge in Ogun State is that they had, I think if I recall what the National Association of nurses, the president of the National Association of Nurses did say about some few years ago, that in the whole of Ogun State, working for the government, within the local government, terms are owned by local government, that they have only about 200 and maybe 260 midwives attending to pregnant women. That's how huge it is. And that if you ask questions around why do you have this, the truth is that majority are retiring and government refused to recruit people into the system. And then before you know it, we had a close up, even before the brain drain. That's one thing to say. The second thing I will mention here is simple. Now, for those that are working in that system, what is the condition of service? It is abysmal. You need to go to some of these facilities and you see where people are living. People are living under places. I mean, people are working where there's no security, one. Number two, when there's security, the roofs are dilapidated. In fact, you need to go deep into studying the facility. I'm sure if you look at the condition of infrastructure around primary healthcare systems in Nigeria, I think it's going to be terrible. That's number two. Now, there's been a law, the National Health Act, that was passed years back to actually help solve some of these problems. And then you have the basic healthcare provision funds. Now, the challenge with the basic healthcare provision fund is like the federal government transfer system to support state and local government by extension. You need to pay counterpart fund to tap into that money. Majority of states refuse to pay their counterpart fund, even when the fund is sitting in there to address some of these challenges. Now, that's even for states that have been able to access the basic healthcare provision directly to the fund, you have different pathways. Of course, I'm talking specifically about the how will I call it now? The basic healthcare provision fund, the pathway that the fund flows directly to the facility to actually address the peculiar needs of that facility. Now, there's a accountability structure that have been set in place to ensure that those funds does not grow wings and fly away. And that's through the World Development Committees. Now, when you look at the composition of those World Development Committee, you are supposed to have at least a minimum of 30% women, and then you have other people so that they can cater for their needs. Unfortunately, politicians have hijacked the entire system. They tend to put their people there, and some of those money are growing wings and flying off. I mean, people need to investigate this. It's been all over the news. You'll see a lot of articles that people have written about this, and there seems not to be accountability around this. So just looking at that narrow bit of the health system that has this direct connection to people, you see the multiplicity of problems that are there. Now, if you are working under that condition, what will you feel as a person? You're poorly paid. I mean, as best, maybe you are getting 30,000 naira if you are happy, if you are lucky. And if you are getting that 30,000 naira, the truth is that that money may not even come to you, maybe for 6 months. What will you do? And you have to cater for your family. And looking at the cost of living, just like you said, the cost of drug has skyrocketed itself. I mean, think about it. The tuber of yam can be as expensive as almost 3,000 naira, 5,000 naira. Some people are paying 2,000 naira for a tuber of yam. So how will you use 30,000 naira and to cater for a family of, let's say, 2, 3 with a tuber of yam? That's not possible. You have to seek alternative. And if there are alternative, you will go there. So the fundamental problem is that, yeah, we have an economic problem that we need to solve as a country. And how do you solve that problem? You have to address the root cause, which you have to put a stem on inflation. And you need to put a floor on the economy upon which you can build. Unfortunately, we seem to be drifting without flaws, and that's where we are as a country. And until we address those things, we put a solid foundation upon which people can stand, which are their social issues, their economic issues, of course, there are behavioral issues, there are structural issues. I can go on and on. There are institutional issues. In fact, they are rational. The way we think as a country, we need to be more rational. We need to begin to take out some things like, so there are a whole lot of things that we need to put into how we design our policy programs to address the needs of the people. I will end by saying this, that the health system during COVID showed to the world that any country that does not take its health system serious has no economic agenda. If you can talk from now to next year, if your health system is not on solid footing, that economy will crumble at the speed of light. COVID showed us. The question is that what lessons have we picked from 2020, 2021? Fortunately, the direction of travel in Nigeria suggests that we don't seem to prioritize what we need to prioritize, and it's painful.
All right. Thank you, Samuel. Moving on to our second story. This week, the initiative in charge of extractive industries transparency released the report that showed that the federal government is owed a lot of money, by 66.4 billion naira and all of that. And I was just thinking, because when I saw this story, I was just thinking that isn't there any system in place for accountability in the oil and gas sector? For me, is it that the government does not have any system in place to prevent revenue leakage in this area? Is anything being done about this? Is there any punishment, just anything to make sure that this revenue is recovered?
Okay. Well, I would say that I would not, in the previous administration, right, we've always had information regarding mismanagement of the economy, right, under the administration. But this current administration seems that they are now actually trying to tackle the leakages, right? They are really being on trying to get a lot of revenue, right, to be able to execute whatever project they want to do, to be able to improve economic growth and achieve their $1 trillion target by 2023. I mean, I think I saw the news maybe on Monday or so. The next thing that came to my mind was that, okay, I mean, this is the amount of money that's being owed. It tells me this is going to cause a revenue shortfall. I mean, the government still depends on oil, still depends on oil, right? To be able to to be able to generate revenue to fund this budget. And when they are not about to get enough revenue, right? What would that would now affect that ability to be able to invest in key sectors to actually boost growth and also improve economic growth, like I earlier said. I mean, this year the government has a revenue projection about, let's say, for 19 points, about 19.4 trillion. So I believe that the government is actually trying trying to take care of these leakages, and this amount that is being owed is actually it says a lot. So whatever systems they have right now, I believe they'll try and intensify it now with the numbers that I'm seeing, because when there's a revenue shortfall, it just means that the government will actually have to borrow more to fund its budget. I mean, over the past, we've had huge public debt stock. I mean, last year, at the fourth quarter of last year, our public debt was about 97 trillion naira. That's an increase from about 46 trillion in the same period of 2022. So, like I earlier said, whatever system they have in place right now, I believe they should intensify it to be able to prevent them from borrowing more, just to be able to fund their budgets.
All right, thank you. So, Samuel, in addition to unpaid royalties, penalties, this different, what we just talked about, there's also a lot of oil theft and crude losses, which has affected the country's revenue generation. Can anything be done to address this? Because as it is, the oil sector is still a major source. We have not yet developed other sectors. Agricultural sector, it's still very plagued by insecurity and other issues. So what can be done about to rectify these issues, just to make sure that we have more revenue coming in from the oil sector? Hello, Samuel, did you get my question?
Yeah, sorry, I was on mute and I was speaking grammar. Sorry.
Okay.
Apologies about that. Yeah.
Welcome back.
So I was saying, yeah, I was saying that, yes, there are regulatory frameworks all over the world that have been built specifically to ensure that this kind of issues never come to fruition. Now, those regulatory framework are based on 4 pillars. One, the structure. We call it the structuralist view. Your structure. The second one, the institution itself. The third one builds on the behavior of the actors in that sector. And then finally, the evolutionary innovation that you bring in. Now, when you look at the oil and gas sector, and specifically the regulatory framework, which is built around the Petroleum Industrial Act itself, the PIA, is it the PIA now? Because we used to call it PIB. I know people will be used to PIB, but it's now PIA. They are set in stones what needs to happen. Fortunately, because of our bad behavioral attitudes, people are looking for ways to enrich their own personal, put money in their own personal pocket. We don't take things like audit serious. And it's not peculiar just to the oil and gas sector. If you look closely, the Auditor General has been writing audit report for decades. And then there are key points that comes out, but nobody does anything with those audits. I think that's the first thing. The second thing I will mention here is that the role of NEITI itself, which was set up, of course, as a citizen government transparency initiative itself, is to pull through those policy decisions. If you look closely at that NEITI report, you will see a long list of recommendations. Those recommendations should have been taken upon by the legislators themselves and acted on. But unfortunately, the recommendation of NEITI has always been thrown under the carpet. Nothing gets done. I know how many reports, how many infographics, maybe they don't understand it, people simplify it, people do a whole lot of work around it, but they get jettisoned. That's the second thing. Now, the third thing I will mention here is that within the executive itself, we allow a lot of things to go through. And it's mainly because of a very weak oversight system that we're operating. How can an oil companies operating in Nigeria be owing you massive amount of money and the country is borrowing and nobody's looking at that direction? That's weird, because certainly the reason why you are not taking that action is because maybe there are some interests that is pulling you away from that line. And it's not peculiar just to this report. If you look at the 80 report over the years, it's been there. Everybody can go and read those reports. You will see a whole lot of recommendation, a whole lot of gap. Even some of the reports indict even NNPC as an institution when it was NNPC. So those are the building block itself. Now, to the question around how we can solve this problem, I think it's simple to solve. We need to strengthen our oversight systems as a country. The first thing is the Auditor General. We need to give the Auditor General teeth to be able to bite, not just back. The Auditor General in Nigeria even a request for you to submit or render account. You may ignore the Auditor General without consequences. We need to sharpen and we need to strengthen those systems. Now, for context, we've been on this audit bill for years. I don't know whether it's been finally passed. At some point in time, it was not signed into law. We need to strengthen those oversight institutions that have been set up by the Constitution to ensure that things like this does not happen. That's one. Number two, the characteristics of people we put in government offices. We need to begin to put credence. We need to begin to put, how will I call it, crown on our public officials' head. When people have very terrible character, I don't want to mention people's name, but when you see people with very, very, very terrible image that don't care, people that speak anyhow, they should never occupy public office, whether at the position. I mean, they should not be holding our resources, our commonwealth in trust for us, because these people are known to be terrible. That's the second thing, the characteristics of people we put in office. Then more importantly, the institution that we have put on ground to go after people is not just Yahoo boys that you'll be running after. We need to be able to hold people accountable. So AFCC, ICPC, what has been their role? If you look at AFCC, for instance, they've been their primary occupation now is to build office. They don't actually go after crime or maybe run after small people that they know they can bully. But those are big issues. So we need to look at that. I think those are the three things. I can go on and on and on. The report itself lists out the recommendation. We need to abide by those recommendations. We need to come back and say, what have we done with this recommendation by next year? I think that's important. And that's why we end by saying a compliance audit is important in Nigeria. We don't just do financial audit. Let's begin to do compliance audit. Let's begin to do financial and performance audit as a country. And then everybody can see clearly what is going on in government.
Thank you so much, Samuel. We'll move to our last story now, which is about Benin and generally Africa. In recent years, many African countries have experienced the rise in political tensions, coups, civil unrest, and challenges to electoral integrity. And even Benin, that was once known as a beacon of democracy in West Africa, there's been a lot of authoritarianism under the current president. And this week, we heard of the arrest of former sports minister and businessman for allegedly plotting a coup. So given this backdrop, Bumi, what do you think are the key factors contributing to democratic instability in Benin and then other parts of Africa? And do you think that this recent coup plot in Benin will affect any other country? Do you think there'll be a rise in coups, or do you think this will be a deterrent, will serve as a deterrent to other people planning coups in other African countries?
Okay. Thanks for that question. But first of all, we have to actually know why there's actually been a rise in this code. I mean, that's in, let's say, 4 years now, you have 7 African countries that have experienced a coup, right? I mean, 4 out of these countries are West African countries, and this actually shows that Benin may have actually averted one, but it does not mean that they would not be prone, to actually experience a coup, very soon. So looking at other African countries, like for example Nigeria, right, and what happened in Kenya, I really can't say if that might happen, because what we have to look at is that why the countries actually experience coup, for example, two of two reasons. Like one, if they notice that there are democratic deficiencies, and if the elected governments cannot deliver the basic amenities that actually need to improve their livelihood. And what is interesting is that um citizens of these African countries, they're actually been okay with it. They are not really seeing anything bad. Like I remember then, for example, like in the 90s when we had the likes of Abacha, we had the likes of Buhari and Babangida and co. Like we were under the military rule, and it was like I really can't remember how it was, but I know that it was like a period of terror and dictatorship and everything, right? I really don't see. I don't know if Nigeria might actually go now, because Nigeria right now, our economy is we are worse off now compared to, let's say, 2 years ago. I mean, the economy is still struggling at barely, let's say, 3%. Inflation is still among the highest in the world. Our poverty rate is about, let's say, 407 million. It can actually be more this year. So, like I said earlier, I don't see, I don't really see other African countries, right? But like, I would go back to what I said earlier, that there's a likelihood that Benin might actually still experience this. Like you actually said, I mean, the president is known for for using forceful ways, to actually do power. So that's all I have for now.
All right, thank you. So my last question on this, because we are running out of time. There are some people who speculate that this coup announcement in Benin may be a way for the current president to extend his tenure. Samuel, do you agree with them? Also, do you think there's any way in which international communities like ECOWAS, Western powers can help curb political instability in Africa? Because there's an increasing crackdown from incumbent leaders on opposition figures, on people that they consider threats to their rule and to their power. So is there any way these external organizations and international community can help address this?
Yes, I think the problem there and then is because, number one, there are economic challenges across Africa and, of course, in the world generally, but it's becoming very, very severe. And when the economic challenges, of course, appetite for coup seems to improve. I mean, we saw that with Niger, saw that in most of the West African countries where the growing appetite is there. And of course, the military man will step out and tell you that he's coming in to rescue the economy from this corrupt class of politicians. That's one. And once you have that, definitely it's common for that to happen. And just like you said, some very, very notorious politicians can leverage that. I mean, it's just not peculiar to Africa. Some people did accuse the president of Turkey of doing that also. They use the opportunity to eliminate people they perceive as political enemies, and they round them off, and then they try to jettison them. So to your question around what people could do, I think people should, number one, we need to begin to, as Africa, we need to begin to focus more on our economic challenges and try to address that. And then we need to remind people of the historical precedents that coup d'etats had created in Africa. Most of the young people now are most likely, for instance, in Nigeria, and Nigeria has been under democracy 20-something years. So people don't know what it means to live under under the junta. People need to remind them. We need that constant, that cognitive overload around the implication of coup d'etat so that it doesn't become desirable. You must have seen people even saying that, and across Africa also. That's the second thing we need to do. I think number three thing is that the civil society systems seems to be becoming weaker by the day. And just like you have, labor unions are also getting weaker, especially in Africa. Those are the checks and balances. And then by extension, the media. We have those three blocks of people that are getting weaker by the day. We need to find a way, of course, of reminding people that have always historically supported civil society to stay on their feet, to continually work on that. People tend to promote more collaboration now between government and citizen, which is good, but notwithstanding that the governance structure, those oversight bits of work that civil society, the media, and then by extension, they do to ensure that you keep a step, we need to continue to strengthen it. Unfortunately, I think after we call it the Trumpism and then the Russian influence, we see most donors seems to be pulling off away from those areas. And that is exacerbating the challenges, of course, within the geopolitical consideration, especially within Africa. So those are building blocks that I can quickly mention here. And then by extension, this external influence, we need to ensure that countries like Iran or Russia that may be fueling some of these things by the ground, we don't give them credence to do that. Juntas, we want democracy to actually take its root in Africa. Let the people select their leaders, regardless of this complex web of international issues that is going on. So we don't get caught in this midst of things. So those are the things that can come to my head here. So building together all these things, I think we need to understand this dynamism more, and then we need to emphasize more on the needs for us that democracy should take root in Africa. And that should be the anchor, that should be the message, regardless of what's happening.
All right. Thank you so much, Bumi and Samuel, for participating in today's episode. To all our listeners, this podcast is by SBM Intelligence. You can access our podcast by searching for SBM Intelligence anywhere you find podcasts. You can also visit our website at sbmintel.com and connect with us on X, Facebook, and LinkedIn at SBM Intelligence. That will be all for today. Thank you. For listening. Bye.